All right, welcome colleagues. My name is Brian Morales. Welcome to the December session of the sub-working groups of the Global Coalition to Address Synthetic Drug Threats. This is the final sub-working group for today. This is 3.3, addressing populations in conflict with the criminal justice system, including alternatives to incarceration. I have a few administrative announcements as we get started. First, the United States is sponsoring a synthetic drugs-focused resolution in the UN General Assembly with the goal of adoption by consensus of all 193 UN member states next Monday, December 18th in New York City. The United States introduced this resolution to highlight emerging global issues related to synthetic drugs and to urge widespread and unified support to address their associated public health and security challenges. This resolution aligns with U.S. efforts to enhance international cooperation on this urgent issue through the Global Coalition and ongoing efforts in the UN Commission on Narcotic Drugs. We urge your governments to demonstrate strong support for this effort to further elevate synthetic drugs as an urgent international priority by co-sponsoring this text and by voting in favor of this issue. Second, I'd like to discuss civil society engagement. As many of you know who were at the July 2023 ministerial, there was a declaration that was adopted to accelerate and strengthen the global response on synthetic drugs that discussed taking into account input from civil society. Subsequently, the consensus of the international organizations and governments was that these sessions that we have on a monthly basis would not involve civil society. It would just be closed to governments and international organizations. So we have developed a secondary parallel plan of engagement that will involve, first, the formation of national dialogues with coalition governments between the months of January to February to engage civil society organizations. The United States will lead by example. On the 27th of January, the White House Office of National Drug Control Policy of the US government will organize a civil society roundtable and will solicit feedback and ideas from the community of civil society organizations, and then post that final report or the outcomes of the meetings on the coalition website. We likewise encourage all of you to consider doing the same and organizing meetings with your civil society organizations at the national level. Second, we will have a global civil society forum organized by the Vienna NGO Committee in late January, and that will bring together in a multi-hour event, again, civil society organizations to reflect sort of global views on how to address the synthetic drug challenges. Third, we will invite civil society organizations to share their experiences through recorded video content on the coalition website and through also other media documents and such. We will, fourth, also invite recommendations from civil society organizations in written or video form in July to April. And finally, April to July, we will invite the CSOs to share their achievements of what they have done related to addressing synthetic drugs. And we will also be posting that on a portion of the website that is dedicated to civil society. Finally, at the discretion of co-chairs, we will also look at inviting civil society representatives to select meetings of sub-working groups, again, at the discretion of co-chairs. Finally, I will share that our website is active, globalcoalition.us. Please visit it, and particularly your sub-working group, where you will be able to see the upcoming agendas for future meetings. We will be posting them there and updating them on a regular basis. And you can also see past recordings from previous sessions there as well. I will end by saying that we also invite coalition participants to submit their own videos. There's no shortage, there's no sort of limitation of length. You can make these as long as you'd like to share your national experiences, recommendations for initiatives that we could adopt at a global level. We would love to receive those videos and also put them on our website. And with that, I am going to turn it over to our co-chairs for today's meeting to get us started. Over to the co-chairs. Thank you.
Спасибо, Брайан. Здравствуйте, участники сегодняшнего.
Thank you, Brian. Hello, hello all participants of Group 3.3. to work with population, a relation with legal system and penitentiary system. We have three very interesting presentations today. We'll listen all of them. Then we'll have time to ask questions and to discuss it. Those who want to ask question in chat, they can use chat. There's a link down on your screens, and let me present first speaker, Sofia Santos. She's a leader of Portuguese National Center of Drug Dependency within European Monitoring Center of Drug and Drug Dependency. We'll listen her presentation with regards to administrative sanctions in legal system. Please.
Before this video is played, the technical moderator would like to apologize for the low quality of audio in this recording.
Я
We
извиняюсь.
tried to improve it as much as we could. We did our best. Thank you.
Good morning, and thank you so much for the opportunity to present the decriminalization of drug use, the legal framework that Portugal is implementing since 2001 as an alternative to punishment that promotes to people who use drugs the adequate health and social services. By the end of the 90s, though Portugal continued to have one of the lowest levels of illicit drugs use in Europe, we were
just
one
want to
of the
interrupt for a
highest
moment, but I
prevalence
think
countries for
someone else is
problematic drug
sharing their
use.
screen.
Drugs and drug
I
addiction
just can't see the
became a
presentation
social,
anymore.
health, and political
stand by,
problem,
please.
and most addicts were afraid of entering programs as they feared.
Yes, somebody's indeed sharing the screen. I'm going to stop the sharing. And I will try to play the video again. Once again, apologies for the glitch.
Good morning, and thank you so much for the opportunity to present the decriminalization of drug use, the legal framework that Portugal is implementing since 2001 as an alternative to punishment that promotes to people who use drugs the adequate health and social services. By the end of the 90s, though Portugal continued to have one of the lowest levels of illicit drugs use in Europe, we were one of the highest prevalence countries for problematic drug use. Drugs and drug addiction became a social, health, and political problem, and most addicts were afraid of entering programs as they feared referral to criminal justice. By that time, around 1% of the Portuguese population were problematic drug users, 98% of those in treatment were heroin addicts, and 48% were injecting drug users. The HIV infection among drug users represented 56% of the total number of infected people, and we had 350 overdoses per year. To face this problem, António Guterres, the current UN Secretary General, who was the Prime Minister at the time, set up a commission to develop the first national strategy on drugs, which was approved by the government in 1999 and included the recommendation to decriminalize drug use and possession for personal use. The principles defined in the strategy at that time still valid today, and they are a policy that envisaged a balanced approach between supply and demand reduction measures. Drug addiction is understood as a disease, and people who use drugs as citizens in need of treatment, having much more to benefit from the accessibility to healthcare and social support than from imprisonment. A policy which comprises prevention programs, a treatment and harm reduction network, and reintegration programs aimed at the recovery of people who use drugs. A new law was approved by the National Parliament and entered into force on the 1st July 2001. This law introduced a radical change in the way of facing drug use. The consumption and possession for use is still illegal, but no longer a crime sentenced with imprisonment and not mentioned in the criminal record. The use and possession for personal use is subject to administrative sanctions. 1. It does not exceed the quantity for an average individual consumption during 10 days. These quantities are defined by law by its sections. The main purpose of the law is the dissuasion of the consumption, and the basic concern has been to give priority to treat offenders rather than applying sanctions. This legal framework does not promote the impunity of consumers and traffickers. Rather the contrary, it allows a quicker intervention among those who use drugs. In order to apply this law, commissions for the dissuasion of drug addiction were created nationwide, which allowed the relief of the criminal courts from the burden of dealing with situations of mere consumption. Those commissions are bodies under the Ministry of Health and seek to inform people and discourage them from using drugs. They have the legal capacity to apply administrative sanctions, but mostly look forward to assessing the user's needs. The commissions act as a second line of preventive interventions, evaluating the personal circumstances of drug users referred by police and directing them to the appropriate responses, treatment, or other. How does it work in practice? Since 2001, when an individual is caught with a small amount of drugs for personal use and there is no evidence that he is involved in trafficking, the drugs are seized by the police and the case is sent to the commission. The police report is carried out immediately and the offender must be present to the commission in a delay of 72 hours. If the police authorities believe to be in presence of a trafficking situation, they will send the matter to the court and the criminal procedure takes place. The Commission makes a psychological and social evaluation of the offender and will then apply the appropriate decision according to the individual profile. If the offender is not willing to undergo treatment, the hearing is suspended and the technical team tries to persuade him to access treatment through motivation. The implementation of the law is based on a network approach. Allocate resources and establish partnerships are of utmost importance to develop action and help the offenders to find their own way. The coordination between the services with responsibilities both on demand and supply field are fundamental for the good working of the commissions and for the support to the offenders. The articulation with the police authorities is essential as they are the ones who initiate the intervention procedure near the drug users. In fact, a bigger pressure of the police authorities has immediate effects on the number of administrative proceedings. Sanctions applied by the Commission can be a fine applied only to non-addict users or a non-monetary sanction such as prohibition to carry out a professional or activity, to frequent certain place, to leave the country, and periodic presentation at the place to be specified by the Commission, among others. These slides give an overview of the global figures of the implementation of the law since 2001 until 2022, with the total number of people in contact with the commissions and the number of non-problematic drug users referred to specialized support, as well as those that were referred to treatment programs. When we compare the situation in 1999 and today, we notice the substantial reduction of the number of problematic drug users from 100,000 in 1998 to 33,000 in 2021. An important decline in infectious diseases by HIV among injecting drug users from 56 in 1998 to 30% last year. A substantial decrease of overdoses from 350 in 1998 to 74 last year. If today we observe a general positive trend of indicators, this is mostly due to an increase on a set of public health-oriented measures that acquired a big occurrence within the legal framework of decriminalization. 22 years after the implementation of this policy, in more recent years, there is a small increase on illicit drug use among adults, but several relevant gains are identified, such as the reduction and delay in experimentation of drugs among adolescents, a significant reduction of injecting drug use, a reduction of opioids-related deaths and infectious diseases, a reduced pressure of drug offenders in the criminal justice system, an increase in the amount of drugs seized, a reduced stigmatization of people who use drugs. In short, Portugal decriminalized all drugs but didn't legalize them. The Portuguese policy on drugs encompasses a model of decriminalization as part of a broader approach designed to prevent drug use, removing criminal sanctions that are ineffective and increase stigma. Instead, significant investments has been made in prevention, treatment, social integration and harm reduction measures directed to public concerns with social benefits to all. Thank you so much.
Спасибо большое, София.
Thank you very much, Sofia. A very contentful material, very useful. I think that the experience of Portugal will be studied by many countries, and the fact that the law was adopted and allowed to be so successful and reach certain goals. I think a lot of countries will look into your direction and will probably adopt some of those best practices in their own countries. One more time, thank you very much. We have our next presenter, Jac A. He is the Executive Director, Treatment Alternatives for Safer Communities, Center for Health and Justice. We would love to hear your presentation, and that presentation will be about the deflection development support. Please, thank you.
So let me get the screen going here. Okay, good. Okay, just before I start, can you see that? Is that up on the screen?
We can see your screen. Go ahead, please.
Okay, thank you so much. Greetings, members of the Synthetic Drug Global Coalition. Thank you for allowing me to be here. As you said, my name is Jac A. I'm the Executive Director of TASC's Center for Health and Justice. The presentation today is going to introduce you to a new word called deflection, and it's going to look a little bit like what you just saw in the presentation from Portugal, which was an excellent presentation, excellent work going on there. And the title, of course, is Creating a Long Overdue Bridge Between Police and Treatment, all, of course, with the goal of reducing drug use and drug-related crime. Before I get going, I want to acknowledge the good work you are doing as members of the Global Coalition, both within your countries and, of course, globally. I do attend the coalition meetings, so I'm participating in them. And also want to recognize, of course, partners. Now, the newest member on the block, ICADI, the International Consortium for ATI, ISIP, Colombo Plan Drug Advisory Program, CCAD, and then, of course, also all our colleagues at UNODC for the work they do that will be in the space of what I am discussing. So with that said, let's go ahead and get going as I introduce you to this word called deflection. The Police Treatment and Community Collaborative, which I also serve as the executive director of, is the global voice for the field of deflection and pre-arrest diversion. So if the contents of what I'm talking about today and what you hear on these presentations is of interest to you, along with the partners I mentioned up front, this is the organization that looks at this field and this practice called deflection as it grows globally. Okay, so to do this, because you are group 3.3, which is the group that I am part of and that I attend, I'm going to set the word deflection and the practice and the movement of deflection within the ATI framework. And so this is a slide from the ATI Policymakers course. If you've not taken this course in your country, it's a great course. I would encourage you to take the ATI Policymakers course, but I'm using this then as the framework for explaining and understanding deflection. So if you've taken that course, or when you do take that course, this is what you'll see. From left to right, of course, is your country's justice system. It's not really your country's, it's kind of a generic country, but the point is every justice system has that light blue space on the left-hand side, and that's where your law enforcement and your police are operating. The gray that says criminal proceeding is about where your prosecutors and courts, and if you have probation, are operating. And then, of course, the red on the right-hand side, post-sentencing proceeding, that's going to be where sometimes your judges are still operating, but your prisons and parole and possibly probation. And of course, the goal of ATI is to use treatment And I'm going to use treatment as a proxy for treatment, housing, services, and recovery. So when I say treatment, it's all those things combined. To use ATI, of course, to divert people. Those are the stars that you see on the screen in front of you. Divert them, a different D word, divert them out of the justice system through the use of treatment. But the interesting thing about ATI is that in its development and practice, for the most part, and again, I really want to acknowledge the good work that we've known about for a long time in Portugal. It really is the gray criminal proceeding, that center block, and then the red post-sentencing proceeding, that red area that you see where courts and prisons and prosecutors and jails and probation and parole have been operating, that most ATI work has been done around the globe. And that pre-arrest space on the left, where police are operating and where law enforcement are operating, the role of police and law enforcement has not been clear in ATI, has not been clear, to the point that at times when we look around at what's going on, we don't really see the police or law enforcement engaged in countries' work in this space of alternatives to incarceration. Now, there's a reason why that is, and it's a very easy reason. You all know it because of your leadership and knowledge of this area. And that is, of course, two key issues about drugs, crime, and policing have not had a good answer based on how a country might be using their police and law enforcement at a local street level strategy. They cannot, through arrest and enforcement alone, do two things. And I'll put those up, but before I do that, I do want to say drug enforcement and the need for drug enforcement remains intact. Deflection does not argue against that. It says there's a missing element to it, and that is the bridge, which we'll talk about. So the things that cannot happen, and you heard this on the presentation from Portugal, is that enforcement cannot stop a person from using drugs or reduce a person's drug use, and as a result, and you all know this, stop or reduce the drug-related activity and crime from that same drug use. That has been the challenge on the enforcement side, and it has not had a bridge over to the drug demand side. That is, until now, with the introduction of deflection at the pre-arrest stage. And so the easiest way to explain deflection, and today's not meant to be a training on deflection, so this is going to be fairly light. The easiest way to explain deflection, which is slightly different than what you just saw in the last presentation, again, which was excellent, is that in deflection, what we're asking police and law enforcement to do, and deflection can be done, by the way, with paramedics, with emergency medical personnel, or with no first responders also. But for today's presentation, I'm just going to do it within the context of law enforcement, but you don't need law enforcement to do deflection, is that we're not waiting for nor needing an arrest, a crisis, an alcohol poisoning, an overdose, or some kind of situation that normally would lead to something bad coming out of it in relation to the contact with police. Instead, in deflection, what we're trying to do is to have early upstream encounters. We're trying to be in a preventative space, and we're trying to meet people where they are, as in on the street where things are occurring. So that's a very easy way to understand deflection, in contrast, of course, to issues around just meeting people at points of crisis or once they are in the justice system. Now, you have probably seen this slide or something like it. This comes from US data. It's probably not too unfamiliar to your own country's data. Effectively, the interesting thing about police is that the vast majority of people they encounter on the street, once arrested, we find out they've never been in treatment. In other words, if you wanted to access your country's population to increase at an early stage before a crisis, before an arrest happened, you could go to your police and your law enforcement and tell us who you're encountering and who they would encounter on that left-hand side bar. This is US, 62% of people arrested have never been in treatment. Other bars on there, 27%, 4%, 7%, are people, yes, who are arrested, but the percentages are much lower. They've had treatment, mental health, substance use, or both. So if you wanted to get at a population early front, go ask police and enforcement and not wait for the jails and courts to be active. And you would still use them, of course. And you all know this too. Why would you want to do that? Why would you get to people early? Because getting people into treatment reduces drug use, crime, and increases employment. But already. So here's another way to think about deflection. This, again, is your justice system, just like the last picture, except what's on here are these four yellow ovals. Each one of those ovals represents a part of the justice system: courts, prosecution, jails, prisons, probation, parole, however your system is set up. That's diversion. That's where most of the ATI work has been done traditionally. But now with the introduction of deflection, we're able to create new opportunities early in the community, on the street, to reduce drug use and drug crime in that space of that big yellow oval that you see on the left-hand side. We can then deflect people by either keeping them in community and getting them connected to treatment, housing, services, and recovery early. Back to this from the alternatives to incarceration, because deflection sits within the ATI framework. It is part of a systems approach of deflection and diversion. Once we have deflection in play, we no longer are just thinking of courts. We now know how to put police into play, and the pre-arrest segment of ATI and deflection now becomes real because we understand how to do it. Now, quickly, I open up with the title of the bridge as we head to a few slides here. I haven't shown you the bridge yet. Here it is. This is a bridge sitting in community. Again, we're not inside your country's justice system, as in inside the prisons or inside the courts. Deflection creates this bridge that allows us to connect for the first time law enforcement, so that could be law enforcement, police, however your country terms them, with drug treatment. And of course, you all know that these two kind of entities have not always had a great relationship together. They don't have a lot of history together. And so it's a pretty important relationship. This also means we can combine for the first time at the street level public safety and public health, which also means, maybe most importantly for you as the global coalition, supply reduction and demand reduction for the first time through deflection are connected through the same workforce of police and law enforcement. The same people who are doing drug enforcement, the police, are also doing drug demand reduction in deflection. Different officers, different units, but the point is they are now connected for the first time together. And that's a huge benefit, which creates for police an option that they've not had before. They can still arrest, but at times they might not need to because they can deflect. They can still take no action, but at times they might not want to because they know the situation with that person is going to degrade worse. So when they see him again, they will now need to arrest him. The person will now be dead or might have overdosed or been poisoned, alcohol poisoning or drug poisoning, and instead they can take no action early through deflection. Again, we're not relying on the arrest. All right, as we head here to very last slide that we have, this is what deflection looks like. Again, not a deflection training. The point is, every one of those yellow things that you see on there is a form of action. There are 6 that we've been able to identify so far, and they're usually done in combination with each other. Won't go into it, so I will finish here. The main thing to understand is deflection is finally creating for us, and I'm going to stop right here, is finally creating for us this bridge that links supplier to reduction to demand reduction, and for the first time allows them to work together, knowing when to arrest, when not, when to take no action, and when to begin to refer people to treatment in the community. Thank you very much, and I will stop sharing. There we go. Thank you.
Спасибо, Джек, за очень интересное.
Thank you, Jack, for this very interesting presentation. It's true that deflection as a term is very new for very many countries, but Jack used very simple language to explain what it is and how important it is. And the bridge that you described can save a lot of lives. And we understand that a lot of different stakeholders take part in building this bridge. And this is both law enforcement and civil society and medical doctors. But the key thing that we heard is prevention, meaning that we don't wait until something bad happens. We start working right there in the community, and it will help us be successful and save lives. Thank you again, Jack. It's very interesting. I think we're going to all take a note and use this in our countries. Our next presenter is Dr. Edson Yarcia. He's a national program officer of the UN Human Rights Program in the Philippines. And we are going to talk about prosecutorial diversion. Please, doctor, the floor is yours.
Thank you very much, Mr. Chair. Warmest greetings to all members of the Global Coalition. Thank you very much for inviting the UN Office on Drugs and Crime Philippine Office to present on the review of prosecutorial diversion as alternatives to incarceration. My name is Dr. Yarcia, and I'm with the UN Joint Program for Human Rights. I want to begin by mentioning that the UN Joint Program for Human Rights is a creation of the Human Rights Council Resolution 4533 back in October 2020. It's a joint endeavor between the United Nations, the Philippine government, including the Commission on Human Rights and the civil society, with a view of further improving the human rights situation in the Philippines. One of the critical work areas under the UNJP is on promoting the human rights-based approach to drug control. Under these work areas, we are building on efforts to promote community-driven responses on a public health approach to drugs. We are working on addressing cross-cutting issues that involve persons deprived of liberty. We are promoting international cooperation for the fulfillment of international obligations of the Philippines. And we're also working with other UN agencies and government partners for shaping the community narrative in relation to human rights. In particular, alternatives to incarceration is one of the work areas that we are primarily concerned with at the UN Joint Program for Human Rights. And in the Philippines, there's a critical need for alternatives to incarceration. The alternatives to incarceration framework is consistent with the new policy direction in the Philippines. During the last State of the Nation address by the Philippine President, Ferdinand Marcos, he declared that the campaign against illegal drugs continues, but it has now taken a new phase. It is now geared towards community-based treatment, rehabilitation, education, and reintegration to curb drug dependence amongst our affected citizenry. In relation thereto, the Justice Department is leading efforts to review the national drug law towards one that is focused on public health and refocusing law enforcement to go against organized and big drug groups. Through this new perspective in the revision of the national drug law, drug problem will be viewed through the prism of public health. And for persons who use drugs and small-time peddlers who are involved in low-level drug transactions, the response will be primarily health, social, and economic services. Our Supreme Court is also on board in this new policy direction, and particularly, there is a recognition that for us to really address drug-related problems, we should not just focus on a legal approach, but it must be comprehensive and holistic. And that includes the involvement of our health and social welfare agencies. The reason why alternatives to incarceration is very important is because if you look at Philippine data in relation to drug cases, majority of the drug cases actually involve very minuscule amounts. The Supreme Court conducted a 10-year survey of drug cases that it reviewed. And from the years 2010 to 2021, you can see in this slide the amount in grams of methamphetamine, the substance of use primarily in the Philippines. Whether it's sale or possession, and these comprise majority of the drug cases, you will see that they involve a very, very small amount, less than 1 grams. And in one case, People versus Holgado, the Supreme Court observed that the dockets of the courts are clogged with prosecutions under the national drug law, and they involve small-time drug users and retailers. And there is a critical problem of focusing on the proverbial big fish. In other words, the court observed that the courts are swamped with cases and they involve very, very minuscule amounts of drugs. Why is this also critical in terms of its implication? It's because if a person is engaged or involved in drug activities, the penalties would include imprisonment. For drug use, after a failed attempt at compulsory rehabilitation, the punishment could be from 6 years and 1 day to 12 years. For drug selling, the punishment is also imprisonment, and it could be from 12 years and 1 day to 20 years. This next slide would show the implication of imprisonment as a main tool for addressing drug cases. You will see that majority of those in jails, 90,062 out of 131,311, are persons in pretrial detention for drug cases, and they comprise around 70% of our jail population. There are human rights implications for imprisonment and a de-emphasis on alternatives to incarceration, and they include impact to justice and public health. For example, in terms of a human rights issue, the Philippines presently is dealing with jail congestion as one of the critical problems. Recently, the Philippine government just hosted the Jail Decongestion Summit with an intention of really trying to address the root causes of jail congestion. And one of the important findings during the Jail Decongestion Summit is that the enabler for congestion would be a focus on arrest and prosecution. In this slide, you will see that for people whose lives include drugs, that include people who use drugs, possessing, or involved in selling, from 2016 to 2022, we have arrested 345, 216 persons. And that has led to prosecution of around 104, 663 persons. And 38,300 are non-bailable, which means that imprisonment through pretrial detention will really be a consequence of an arrest and prosecution. And this also has implications in terms of the length of time that the persons deprived of liberty will be spending in prison. On average, we have 528 days waiting time if we focus on arrest, prosecution, and imprisonment. And therefore, in the Jail Decongestion Summit hosted by the Philippine government, one critical finding is that restorative justice and public health are affected by incarceration or imprisonment as a primary mode of addressing drug issues. And this has also disproportionately impacted the poor, and it has not met the goal of addressing the root causes of drug-related issues. Because one of the critical scholarship results or findings would demonstrate that Filipinos use drugs and engage in low-level transaction for economic and social issues. What is the remedy that we are looking at through the UN Joint Program for Human Rights and through the Philippine government? We are looking at alternatives to incarceration as a remedy to address not only jail congestion, but also the larger issue of drug-related problems. One area where different member states can consider is what we call prosecutorial diversions. This is the diversion at the level of prosecutor so that we can support bringing people back to their family and community where there are available health and social welfare support system. Some of the tools for alternatives to incarceration present in the Philippines as of the moment would include supporting plea bargaining, supporting bail remedies, speedy trial remedies, release on recognizance, good conduct time allowance, parole, and probation. These different tools for alternatives to incarceration would shift or would divert people away from closed settings such as jails, prisons, and compulsory rehabilitation centers back to their family where there are, or community where there are available health promotion, prevention, treatment, rehabilitation, and harm reduction. And all these services should also encompass dimensions on economic, social, and health services. Presently, there are some policies in the Philippines that promotes prosecutorial diversion. One is the Department Circular number 20, issued this year, 2023. It is the policy issuance on the proactive involvement of prosecutors in case build-up. Through DC-20, prosecutors can collaborate with the police and in fact mandated to collaborate with the police so that law enforcement, policing will be compliant with human rights standards. And one of the envisioned objectives for a proactive involvement of prosecutors would be that a law enforcement investigation, for example, will not automatically lead to a filing of a case because there's an assessment on the level of evidence. And if there's good prosecutor and law enforcement collaboration, then we will lessen the congestion, especially in pre-trial congestion. Another option is the prosecutorial diversion tool for bail. Through Department Circular number 11, the government reduced the amount for bail, and this promotes diversion of people away from jails and prisons so that persons deprived of liberty or those persons undergoing criminal proceedings would have an option to participate in criminal justice proceedings and not necessarily participate while they are incarcerated or in pretrial detention. Finally, there's also the promotion of the plea bargaining tool. In the Department Circular number 18, the revision of the plea bargaining guidelines of the national drug law allows for an option for those charged with offenses to plead guilty for the lower offense. Of course, there are issues here in relation to human rights implications, for example, and this has to be reviewed to ensure that they comply with due process requirements. However, because of the prosecutorial diversion tool of plea bargaining, we have observed that many of those charged with drug cases were referred to aftercare services or community-based rehabilitation treatment. So that's an opportunity as well to link people to care. And those are some of the options that are being optimized at the level of the prosecution. So as a final point, looking ahead, the Philippines is looking at a demonstration project for alternatives to incarceration, in particular, revisiting the client flow for drugs. In a way, we are looking at how prosecutors can be optimized so that through the present client flow, we can refer people to health and social welfare services. Through the INL support as well, the Philippines is currently conducting a demonstration project on alternatives to incarceration. The idea is very simple. We don't need criminal investigation, arrest, detention, or court processes so that people can be assessed by health sector, so that people involved with drugs will be linked to health promotion, harm reduction, rehabilitation, treatment, livelihood support, and socio-economic development. I'll end here. Maraming salamat po.